From the JAMA Network, this is JAMA Pediatrics Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Pediatrics.
Hello, podcast listeners. This is Dimitri Christakis, Editor-in-Chief of JAMA Pediatrics, coming to you again with Dr. Alison Galbraith, Professor of Pediatrics at Boston Medical Center. Today, we have our first Canadian guest ever, Dr. Sheri Madigan, who is the Professor of Clinical Psychology and the Canada Research Chair in Child Development at the University of Calgary. Hi, Sheri. Thanks for joining us.
Thanks for having me.
So we've brought you here today to discuss an important issue around screen use in young children, and you are one of the world's experts in this topic. We published quite a bit of research in this area. Actually, we published quite a few of your papers. Ali, why don't you just set the stage with the paper that got us thinking about this?
Yeah, so this paper that is called Screen Time at Age 1 Year in Communication and Problem-Solving Developmental Delay at 2 and 4 Years by Takahashi and colleagues. It was a cohort study of about 7,000 pregnant people in Japan recruited from clinics and then their infants, and they followed them through age 4, and they measured screen time at age 1, so we can talk about that. And then they did ages and stages questionnaires at ages 2 and 4 to see how screen time was related to different domains of development, including communication, gross motor, fine motor, problem solving, and personal and social skills. And so what they found was that increased screen time was associated with a higher risk of developmental delay in particular domains, so at age 2 and 4, both in communication and problem-solving domains for those with more than 1 to 2 hours a day. But they didn't find any association with gross motor or fine motor development.
So Sheri, before we have you react to the paper or this general topic, tell me what got you interested in this field. There are not very many people interested in early children's use of media and development.
Yeah, that's a great question. So previous to studying screen time, I studied lots of different determinants of child development. And then having my own children, many of whom were born in the last 10 years, I got really interested in thinking about, well, what is this role of screens? And noticing real individual differences, even within my own children, how some were able to just get off when I asked, while others needed to be asked 3 times. And we had to come up with all these strategies to actually get them off. It really got me thinking, oh, what role is this playing? And I think the birth of my children also coincided with handheld devices. So 2011, the iPad came out. I had a child born in 2011, and I just saw such a drastic change in the last decade, and it got me really interested. And studying it in a perfect marriage, I also had the data where we asked these questions, and so I was able to actually jump right into it and really start to dive into trying to figure out what's going on for kids and what role does screen use play in addition to all these other determinants of child development in terms of their outcomes.
Sheri, tell us about this topic in general. You heard what Ali summarized. I'm guessing those findings weren't surprising to you, or was there anything surprising in them?
They weren't surprising to me. I think in some ways they confirmed what we'd already really know, but in a really large sample. So that's a real strength of this study, is the sample size. What we've all been talking about is what's this digital tipping point? How many hours is it that really kind of makes a big difference in terms of kids' outcome? And I think this study really provides a sense of that. It tells us that 4 or more hours is a real digital tipping point, although there's some signals that even getting 2 hours is important, but 4 or more hours is really going to make a big difference. I guess one thing that I found interesting is that really only a small subset of the sample was getting 4 or more hours. Like 290 kids were getting 4 or more hours. You know, if we want a positive takeaway from here, a lot of kids are meeting the screen time guidelines in this sample, but those that are really getting a lot are seeing some problematic outcomes consistently. And I think that speaks to the other data that suggests, like, once kids get on these pathways of high screen use, they tend to stay there. And that's where we see these really consistent, more problematic outcomes for them in terms of these developmental delays.
So what would be the different types of devices that would be used by a 1-year-old child?
Most of the time at that age, it is primarily television. This study was also collected in 2013 to 2017. So a good guess is that it was primarily television or some type of streaming device. It's usually only a small subset of kids who start getting on digital devices, although it does start to creep up later in that early development period. Around 4 or 5, they start wanting these handheld devices. But at this age, it's primarily TV or some streaming device.
I wanted to follow up on your notion of a digital tipping point, because you framed it, and maybe appropriately at this age group, that it kind of doesn't matter what the kids are doing. It's just enough time that at that young age, it's displacing other healthy, important developmental activities, whatever they might be, playing, socializing, being physically active. Is that right? Would you say that there's better or worse types of screen use in this age group? And is it right to lump them all together?
Well, I think in this case, we're just really looking at time. We're not looking at what they're doing on those devices. It's okay to lump them together because it's really just that variable of time. I use the digital tipping point idea. Really what that means is as the dose-response relationship goes up or as kids get more devices, it also means they're getting less of something else really important in early childhood development. So they're getting less face-to-face time that we know promotes language development, less of these serve and return interactions that are so critical for so many aspects of their outcomes. They're getting less physical activity. They're probably getting less sleep. We know that screens and sleep work together, so kids who get more devices, especially early, actually get fewer minutes of overall sleep. So I think we have to get beyond this idea of it's just the screen time. It's actually what they're not getting when they're getting that screen. Yeah.
I always had thought the displacing of physical activity was a big deal, but it was interesting here. I mean, these kids are little, but the developmental, like the gross motor and fine motor, those were not affected.
Yeah, I was really surprised by that finding as well, because you would think that gross motor would be a likely outcome where there'd be some delays. And they offer an idea about reverse causation there as a possibility.
Explain what you mean or what they mean by that, Sheri, so that our listeners who may not have read the article know what you're talking about.
Yeah, so they suggested that it's possible that kids who have developmental delays or gross motor delays, maybe that's predicting more screen time later on rather than the reverse of that. That is always one possibility. I do think it was a really surprising finding, and I'm not sure I have a good understanding of why they didn't find that particularly for gross motor skills.
I'm curious, when we talk about screen time at all ages, but certainly at these young ages, do you count video chatting as screen time?
So according to the screen time guidelines, kids under the age of 2, video chatting is okay. It's okay for 2 to 5-year-olds too. So there seems to be this provision in the screen time guidelines that video chatting is okay. I think that's in part because, we need to recognize and be sensitive to the fact that people live all over the place, and there's grandparents who might be several thousand miles away and still want to talk, and that should be okay. They should be actually involved in their development in some way. I actually like that provision in the guidelines because I think it's really important in terms of getting people to think about screens as being a point of connection and being meaningful in some way. And I think that when we video chat, it's meaningful because we're usually video chatting because we want to spend time with the other person. But I've actually had a lot of grandparents ask me, I know screen time's bad, but I still want to talk to my kids. So what should I do? And my suggestion to them is often don't just sit on the screen, but share an apple together, read them a book, make it meaningful in some way so that they get lots of exposure to language. There's a nice back and forth dialogue, and there's something meaningful to the interaction, even though it's taking place on screen. So I do think that video chatting piece is important, and I think we should actually further contextualize it for folks so they can make that video chatting time really meaningful, especially for a 6-month-old who they'll just find the video chat so novel to begin with. Making it meaningful will actually give them some context for why it's important to be on it.
So there are other ways that screen time can be beneficial. Are there more constructive types of screen time you can give a kid this age?
Well, I think this study tells us in small doses, screen time is actually okay. And I do think people need screens in small doses. So if a parent needs to put on a screen to cook a good meal so the family can sit down together and have that together, that's a great use of screen time in some ways. It's just that once we start using it in these really high doses is when it becomes problematic. And that probably means that's because the child's alone and it's displacing all these other things. We have a study also in JAMA Pediatrics that really shows that increased screen time is associated with poorer language outcomes. But when we really look at the context of it, so if you're sitting there and you're co-viewing it with your child and hopefully then bridging understanding, saying things like, oh, hey, that's Elmo, and Elmo's red, and you give some context, we're actually seeing that when co-viewing is happening in the context of screens, there are some benefits in terms of the child's language outcomes. And that's probably because there's just more conversation and language exposure when you're sitting there and enjoying it together. So I do think it's really important, again, to contextualize that it's not just about duration, but how we're using screens and whether we're using them in a meaningful way that scaffolds development in some way for kids.
I agree, Sheri. I mean, I think we should really focus on content, context, and amount. So it becomes a little bit difficult to figure out what the healthy diet is. I think that pediatricians should be urging parents to talk about children's digital profiles, their digital media usage in a very deliberative and intentional way, instead of just thinking about the number of hours or even the sites, to get them to have a deeper understanding of the design elements that are dragging them in. I mean, the fact of the matter is that this is an addictive product and it's designed to be addictive, and children should be mindful of that. So the other thing, Sheri, I wonder about, you don't have to answer this speaking about your own children, but we talk a lot about differential susceptibilities in children at a population level. But actually at the individual level, obviously they apply as well. Or would you advise parents to have different rules for different kids or to set different limits? In every other arena, I could tell you as a parent of 2 grown children, the expectation was always that the younger child would get everything the older child got at a younger age. Yeah, earlier. And with the exact same limitations or fewer.
It's a great question. I do think you need slightly different rules depending on the tendencies of your kids for engaging in screens. If you have really responsible kids, you might give them a cell phone earlier. If you have really responsible kids, you might not have to put screen limits on their phones, like, turning it off at 9 o'clock and letting it come back on at 8, because they're already actually getting a good sleep. They tend to go towards the phone. So I do think you have to adjust. I do think general rules around limits and how we're going to use screens as a family is really important. So you got to have those conversations early and often, and then just adapt them to the individual needs of each kiddo in the house.
Sheri, I want to thank you so much for joining us. I always learn a lot when I talk to you, and even though this is a topic I know a lot about, thank you for sharing your knowledge and your firsthand experience with children and screens.
Yeah, thanks.
My pleasure.
This episode was produced by Shelley Stephens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.